If you're approaching 65 and you're covered underneath an employer health insurance, whether it's your employer plan or a spouse's employer plan, there are three important questions to ask yourself before you do anything ever when it comes to Medicare. There's a lot of bad letters, bad advice out there. So in this video, let's talk about what are those questions and what should you be asking yourselves before you make any assumptions when it comes to Medicare. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both the Medicare rules, the government rules of Medicare, but also the insurance company options to help you get the right Medicare plan to have really good health insurance while also protecting your retirement savings. Now, in the section below, I'm going to share with you some extra free resources to get shortcuts to Medicare, but Medicare can be great when you do what's right for you. So let's hop into this. As I mentioned, as more and more people are working past 65 or their spouse is working past 65, there's some really important things to be aware of when it comes to Medicare. And the thing is, when I talk to people, I see the government sending very misleading letters. I see the insurance agents giving bad information. And I also see people's current employer insurance sending completely incorrect information on Medicare. So I want to get clear in this video, what are the three things that you should be doing and asking yourselves before you ever take any steps when it comes to Medicare? And the first question is, if you are covered by an employer plan past 65, does the employer plan meet Medicare rules? What does that mean? Medicare rules say by the time you're 65, you must either be on Medicare or covered under an employer health insurance plan that meets Medicare rules. And the three requirements is one, you have to have an employer plan that does not require you to have Medicare Part A or B. The second requirement is, does the employer providing the health insurance have 20 employees or more? And number three, does the employer's prescription plan have creditable prescription drug coverage? That means that the plan on average covers medications as well as or better than Medicare. Your company is legally required to confirm this for you every single year. So before you do anything else, ask your employer, does it meet Medicare rules? I had a client last year who got a letter from her Blue Cross Blue Shield employer plan. And the letter said something along the lines of, you must join Medicare or your employer coverage won't work. And I said, well, that's unique because her employer plan has no mention of Medicare A and B. Her employer plan has 20 employees or more, and her employer plan is creditable. I have the letter in front of me. So with the client, I called Blue Cross and I said, what's this letter? What do you mean by that? And they go, let me transfer that to they say, that's from the marketing department. Let me transfer you to someone else. And once we got to the actual person at Blue Cross Blue Shield, they said, oh, that letter's not correct. She's fine. She does not have to join Medicare. So had she not questioned the letter, she would have joined Medicare. It would have cost her over $6,000 a year. And it would have impacted certain Medicare options that she had once she eventually joined Medicare. So again, before you assume the letters that they're sending you are accurate, ask yourself those, does it meet Medicare rules, those three requirements, and be thoughtful, okay? Number two, if the employer plan does meet the Medicare rules, we then ask ourselves, well, which one's better coverage, better price, all those things. So we want to look at things like, what are the premiums? What are the out-of-pockets? Does your doctor take the Medicare plan or the employer plan? How well are medications covered? Things like that. But we want to look at the costs. As I record this, for most people, the tipping point is, if you are paying $250 per month per person on your employer plan, and the out-of-pocket cost on your employer plan is around $3,000 or less, your employer plan is usually the better option. Now, again, depending on where you live, what your income is, what your health situation is, that kind of tipping point can change. But that's a tipping point for most people when we're comparing the employer plan and Medicare. So if you're paying, say, $500 a month on your employer plan and the out-of-pocket is, say, $5,000, there's a good chance that Medicare is your better option. And so we want to understand, what do the costs look like? Okay. Also, we want to ask ourselves, what is the benefit am I getting by joining both Medicare and an employer plan? In most cases, it is a total waste of money to both pay for Medicare and also pay for an employer plan. Now, if you have family members on your employer plan, like a spouse or a dependent child, there could be a case where we could justify having both, but that doesn't happen very often. And so if you're paying for both an employer plan and Medicare, or your friend is, scratch your head and say, does this make sense? In most cases, it does not. Now, again, retiree plans are not employer plans. COBRA plans, not employer plans. Marketplace plans, private plans, Medishare plans, not employer plans. Medicare is very clear that what we just talked about only applies to active employer plans. The rest of them do not count when it comes to these things. So it's confusing when it comes to both coordinating employer plans and Medicare. It's not, we do it a lot, but just be thoughtful, as insurance companies are not, and likely the government is not talking to you about these important rules. So be thoughtful, do the right thing to can protect yourself financially, but to also have that great health insurance. I'm Emily with the Medicare Coach, and make sure that you leave your comments and questions below. And here's to helping you easily make your right Medicare decision.